So hi everybody, my name is Pooja and I'm going to be talking about my research, which is on exploring the experiences of trans young people attending an alternative education provision, a multi-informant case study. So just before we get started in the in-depth in my research, I thought it was really important for us to just talk about the key terms that I'll be talking about. So I'm not sure if you're aware, the genderbread person model is a really nice model which simplifies sort of the different components of gender and sexuality. And as you can see there, the gender identity spectrum is quite a long spectrum. And you can see in the middle there, there's terms called trans and non-binary. And that's the terms that I'll be sort of referring to in the research. So trans is an umbrella term that is used to sort of include lots of different gender identities. And that's gender identities that don't match the assigned sex that someone is at birth. And we also have cisgender, which is a person's gender identity and it does match their sex at birth. So that's the two different terms that we'll be using. So a little bit about me and why I've chosen this area to do my research in. I previously worked in MenCap and I worked really closely with an alternative education provision. And this provision was specifically catering for children and young people with psychological health needs. And when I went in there to do some work, there was a lot of trans young people within the setting. And I supported them to kind of gain their voices for their education and health and care plans. And it gave me an insight into sort of the key issues and the challenges that they faced in their educational settings and also in the wider community. And this helped me to develop my first year research project. And I did my pilot within this specific alternative education provision. And because of the positive findings I had, I wanted to develop my research further and I continued it as my thesis. So the aim of the current study is to generate knowledge about the experiences of trans young people attending an AEP, and their perceived impact of the change of settings. So that's them moving from mainstream setting to an alternative provision and sort of the impact on their overall learning and well-being. So what does the existing literature tell us? So there is a lot of literature on trans young people, but it's mostly in the United States. So we have obviously a different education system there, there's different legislation, but what we do see is that the trans young people have negative school experiences in general. So they're more likely to be name-called, experience harassment, physical harassment, and they miss lessons due to fear of discrimination. And also eventually this sort of leads to difficulties in their mental health. So they internalize some of the stigma and that leads to anxiety, depression, and they're more likely to have self-harming or also suicidal ideation. So it's quite severe in terms of the impacts on their well-being. There's also been interesting research at the moment, which is to do with autism. So there's an association between trans and young people having a diagnosis of autism or even autism traits. So at the moment, there are only clinical samples that are showing us that there's an association between the two, but we don't have any of the perspectives of the young people. We don't know what their life experiences are, and we don't know what their sort of school experiences are. But we do know that they might be at risk of having poorly attuned care because they can't advocate for themselves or communicate their needs as well as other children. Some of the research also shows that some of these young people would like to be in more of an alternative provision because they feel it's more individualized and it's a bit more friendlier for LGBT youth. However, in the UK, there isn't any research within alternative education. And because I had a really good connection with an alternative provision, I wanted to kind of explore what the setting was doing to support these young people and look at some of the positives as well and some of the negatives in terms of what their experiences were in mainstream. So we covered this slightly. So understanding sort of trans young people's experiences really help us and educational professionals, because we can understand sort of contextual issues that could affect them. And clearly I'm using Bronfenbrenner as my theoretical framework, so looking at the differences between contexts and how that could affect development, and also looking at individual factors as well, so how the young person is able to cope with school life, what kind of resources they have. For example, if they do have autism, that might affect them with interaction skills, etc. So I'm looking at that model, and that might help educational professionals and EPs to sort of think about that work within our practice. It also provides a novel insight into the experiences of those with additional needs. So we don't know anything about their experiences, so that will help us broaden our knowledge. So the main research question is, what are the experiences of well-being and educational support for trans young people in alternative education compared to mainstream school settings? The methods that I used was purposive sampling. So as I explained, I selected one case, which was that alternative education provision that I knew. And I thought that was a really good way of using some of my connections as well with that provision to recruit. The research design was a 4-phase single quantitative case study, and it was with multiple informants. So as you can see, there is a phases with parents, young people, and staff. So I gained a perspective about the experiences from a range of different people. And phase 1 was really important because of the COVID-19 pandemic, differences in terms of trying to engage with vulnerable young people, it was quite hard because they didn't like to be online. So I had to consult with the head teacher over like numerous calls, and we decided to think about ways of trying to collect the data and engage the young people in a way that they were feeling comfortable with. So my design was quite flexible and dependent on how they wanted to communicate. So they had lots of range of, I guess, options in terms of how they want to communicate with me. So the participants in total was 18. So we had 5 trans young people. They were all diagnosed with sort of SEMH needs because there was a CAMS practitioner attached to the unit, and that's the different needs that they identified. And 3 of them had a ASD diagnosis as well. I also had their parent carers. So I had 6 parent carers. And I had 7 staff members, and a lot of the staff members were working closely with these trans young people, so they knew them quite well. The analysis was a thematic analysis where I kind of looked at all of the interviews. The main themes, as you can see, we've got 5 main themes that came across through all of the interviews. So we've got a lot of the different sort of contextual factors which came under school climate. So thank you. And that was school climate, and that included the sort of ethos and beliefs within the school environment. We've got understanding gender, identity and available support, school relationships, mental well-being and additional needs, and preparing for adulthood. So just to fast forward, some of the really important and interesting findings was that there was more positive experiences in the alternative provision compared to the previous mainstream school settings. So some of the young people, they actually attended a faith school or a same-sex school, and they felt that they couldn't be themselves. They hid their identity. There was outdated, gender stereotypes that were within those settings, and outdated views on gender, which really affected their self-acceptance and their well-being. When they moved settings, things improved, and I'll go through that a little bit more. The other finding was that the young people diagnosed with ASD, they actually had significant mental health difficulties, and that related to sort of an increase in anxiety and suicidal attempts. So that's something I noticed between those with no ASD diagnosis and those with an ASD diagnosis. So some of the main supportive practices in the AAP included inclusive school climate, so providing gender-neutral toilets. Gender was represented in the curriculum, and there was access to sort of LGBT clubs. They also used the correct pronouns and names, which is really important. So the language that we use around the trans young people plays a massive role in how they feel about themselves. Peer support was really important because they were around like similar peers, which helped them to have a sense of belonging in school. Genuine and trusting relationships with staff. So a lot of the young people were talking about how they felt the staff related to them. So they had like an open way of discussing gender. They were really knowledgeable on the topic. They had an attuned interaction with them. They listened to them and they provided containment. Sorry, I'll just fast forward. Yeah, and the small nurturing environment really helped those with ASD. And lastly, this wider school policies such as flexible uniform policies helped with self-expression, and anti-discrimination policies helped with feeling safe in school. So just lastly, some of the implications. So just really quickly, so as EPs, what we can do is, make sure we're using the correct language around the trans young people. So within consultations and within our paperwork, make sure that we're using the name that they want to be called as well. Supporting parents is really important. So supporting their understanding of gender, supporting their understanding of gender identity in society as well, and challenging sort of those negative attitudes towards gender and trans young people by educating them, training them. And one of the main things I want to talk about was delivering staff training. So on interpersonal skills, and we could use big principles to do that. So looking at how to actively listen to a young person, how to contain them. So those sorts of aspects really help with their well-being and just understanding of their own gender as well. Yeah, thank you.